Welcome to the deep dive. Today, we're plunging headfirst into, well, a health crisis that's just exploding around us. We're talking about diabetes. The numbers are truly staggering, hitting close to home for so many. Think about it. Over 21 million diagnosed in the U.S. alone. Then there's another 41 million with prediabetes. And here's the real kicker. The CDC actually estimates that 1 in 3 children born back in 2000 are expected to get diabetes in their lifetimes. It's not just, an inconvenience. It's serious, chronic, pervasive. It's really grown into what you can only call a health catastrophe. So our mission today, we want to explore the insights from the 30-Day Diabetes Miracle by Dr. Franklin House. This book, it isn't just about managing symptoms. It's about understanding the core reasons why this crisis has grown so fast, and maybe more importantly, how you might reclaim your health through a pretty powerful lifestyle program.
And that's exactly where this deep dive might feel a little different from conventional thinking. The book really hammers home this key distinction, talks about healing from within. That means becoming whole again, physically, mentally, emotionally, socially, spiritually, not just curing or managing symptoms. What's really interesting is that the book and the program it lays out, they seem genuinely interested in achieving both of those things. Powerful stuff.
That really is a powerful idea. And look, the program in the 30-Day Diabetes Miracle, it's not just theory floating around. It's been proven, tested over 11 years at the Lifestyle Center of America, or LCA, down in southern Oklahoma. It claims to help people really conquer diabetes, often with way less medication and sometimes even less insulin. And while its main focus is type 2, the information, the strategies, they're incredibly relevant for type 1 folks as well. When you step back and look at the scope, the numbers are just, well, sobering. Just picture a big city like New York. More than 1 in 8 people there already have diabetes. That's not just a number on a page. It's a huge chunk of the population really deeply affected.
Mm-hmm. And that brings us right back to that core idea the book emphasizes, healing versus curing, to clarify that a bit.
Yeah.
Curing, that's usually what your doctor does, right? Eliminating the disease with some kind of external intervention, maybe medicine or surgery. But healing, as the book describes it, that's deeper. It's a personal journey. It has to come from inside you. It's about becoming whole again on all these levels, physical, mental, emotional, social, even spiritual. And the authors seem genuinely invested in helping people get both.
What I found really empowering in this book is its central message. It's almost provocative, actually. It says, type 2 diabetes isn't something you just catch like the flu. Almost all cases, according to the authors, develop through specific food and lifestyle choices. Choices, they say, are totally within their control. It's a massive statement about personal agency, isn't it? But it carries a lot of weight, too.
Oh, absolutely. And the book tackles that directly. It suggests that while the power to change is right there inside you, the real challenge is often undoing years of habits, maybe even bad information. Building on that, the book is pretty firm. Medication should be secondary. It shouldn't be the first thing you reach for in diabetes care. So many patients on this 30-day program drastically cut down or even get off their meds entirely, including insulin. Now, for type 1 patients, obviously they need insulin to live. But the authors note that even for them, using less insulin often leads to better health, fewer complications. The core idea is simple. No magic pill or secret cure for diabetes. The power comes from the choices you make each day.
And that leads right into this crucial point the book keeps stressing. If it's to be, it's up to me. This program really, really demands that you take charge of your body, your disease, your future, basically, through fundamental changes in how you think and act. Changes that are doable, though, but the benefits you get, they're directly tied to the effort you put in. It sounds like tough love, maybe, but seems incredibly effective.
It really is. And the authors themselves kind of embody this. Take Dr. Franklin House. Born into poverty in Mexico City, came to the U.S. at 15, worked his way up to become an MD. But his path was really shaped by 2 big realizations. First, how little nutrition training doctors get in medical school, which is shocking, really. And second, just seeing how widespread chronic disease was. He shares this really moving story about his wife, Bonnie. She suffered for years with terrible arthritis. But then, through a plant-based diet and lifestyle changes, she found total and enduring relief. That experience led him to fully embrace lifestyle medicine in his own practice. It was personal, it changed everything for him.
That's a powerful story. Personal transformation really driving professional change. And speaking of finding a new path, the book also introduces Dr. Stuart Seal. What was his journey? How did he also arrive at this focus on lifestyle?
Well, Dr. Seal, he was apparently inspired by the old TV show Marcus Welby, MD, to become a family doctor.
Yeah.
But despite getting excellent medical training, he got frustrated just seeing his patients' problems being managed, not really eradicated or reversed, just managed. His own wake-up call came in his 30s. He realized he was about 40 pounds overweight, getting breathless easily. That pushed him to try a plant-based diet and get more active. And just like Dr. House, he realized how much basic nutrition knowledge was just sorely lacking in his own medical education.
Yeah, you can really see how their paths kind of ran parallel there, both realizing that traditional medicine, for all its strengths, was missing a huge piece of the puzzle for chronic stuff. Dr. Seal's frustration, watching patients eat the very diet that had put them in the hospital in the first place, I mean, you can almost feel that, can't you?
Absolutely, they both hit the limits of a system that wasn't digging down to the root causes.
And to really make this concrete, the book shares the story of Ian Blake Newman, a real patient. He had type 2 diabetes, a long history of surgeries, chronic pain, just a tough situation. I found LCA through a magazine ad. He admits he was skeptical at first, called it sugarless farm, like a boot camp. But his transformation was just incredible. Cut his insulin by over half, lost 35 pounds, got off other meds, regained hope, even his vision improved. He tells this touching story about helping a woman in a wheelchair when they first got there, and then just 2 weeks later, seeing her walking around the track, no wheelchair. As Dr. House apparently told Ian, that new feeling you have is called health. It really hits home the kind of deep, holistic change they're aiming for. Okay, so let's unpack this a bit more. The book really digs into the why of diabetes, physiologically speaking. It starts with insulin resistance, calling it the real culprit.
Right. And to get a handle on that, they use this great analogy like a long-distance runner. Imagine you're running a marathon, right? Your cells, especially those hardworking muscle cells in your legs, they constantly need fuel, glucose. Insulin acts like Paul Revere riding through your bloodstream shouting the news that glucose is available. It basically unlocks the cell doors so glucose can get in and provide energy. It's the key.
That's a really clear visual. So, using that Paul Revere idea, how does the book then explain the fundamental difference between type 1 and type 2 diabetes?
It makes it super simple. In type 1, Paul Revere doesn't ride and shout at all. Basically, the body just isn't making enough insulin to open those doors. But in early type 2, he rides and shouts, but no one along the way seems to listen. The insulin is there, but the cells just ignore it. They resist. They've become unresponsive.
Ah, the lazy cells concept for type 2, that's what they call it, right?
Yeah.
Can you elaborate on that? How do cells get so lazy?
Exactly. Think of those cells like little rooms. They're constantly being flooded with more energy, more glucose, than they actually need or use. When you've got too much energy in and not enough energy out day after day, these cells are just swimming in excess energy. And over time, they kind of shut down their response to insulin signal. They become resistant. So your pancreas senses all this sugar building up outside the cells, and it starts shouting louder, producing even more insulin to try and force the doors open. And here's a critical point. You can actually have high insulin levels circulating for a long time before your blood sugar even starts to register as high.
Wow. So what does all that mean for your health? The book is pretty emphatic about the dangers of both high blood sugar and these often missed high insulin levels.
That's right. Let's take high blood sugar first. The main issue there is what they call small blood vessel disease. Think of tiny pipes getting clogged. This can damage small vessels everywhere, leading to blindness in the eyes, kidney failure, and neuropathy. That's nerve damage, often in the feet and legs, which can tragically lead to amputations.
And the high insulin. Just as bad, but it affects the large blood vessels more. Remember, insulin's a growth hormone, so too much of it makes you more likely to gain weight, which, guess what, makes insulin resistance even worse. It's a vicious cycle. High insulin also makes it harder for your body to break down fat and easier to store it. Plus, it's linked directly to high blood pressure rigid vessels, holding on to sodium and poor cholesterol numbers. High total and LDL, low HDL. And here's a really alarming statistic the research highlights. 65% of people with diabetes die from heart attack or stroke. And for women, diabetes means a 5-fold increase in heart disease risk. That's huge.
Yeah, and it doesn't stop there. High insulin has other, maybe more subtle but still serious effects. Studies show it messes with sex hormones, both testosterone and estrogen, that can cause problems with the prostate, gonads, even skin and hair. And in women, high insulin is thought to be a major player in polycystic ovarian syndrome, PCOS, leading to things like ovarian cysts, irregular periods. The big mistake many doctors make, according to this book, is just focusing on blood sugar and completely ignoring the high insulin and the underlying resistance.
It's amazing how much gets missed looking only at blood sugar. But the good news, the book says, is you can often spot trouble brewing long before a formal diabetes diagnosis. So what are some of those early warning signs, and why do they often get overlooked?
Exactly. One of the very earliest signs, often missed, is having persistently high insulin levels, even if your fasting blood sugar looks okay on a text. It's like a body's already working overtime, shouting louder, even though the sugar hasn't quite overwhelmed the system yet. Another sign, something you might even notice yourself, is if your blood sugar stays high, say over 140 milli-GDL, 2 hours after you eat. That's a big red flag.
Yeah.
The book really stresses that these early signs, high insulin, post-meal spikes, even slightly elevated fasting glucose, what they call impaired fasting glucose, or prediabetes, like 100 and 125 milli-GL, or even over 90 for men, these are all crucial opportunities to intervene before things get worse.
And bring this back to you, the listener. The book states very clearly that prediabetes and type 2 diabetes are 95% lifestyle and environmental diseases. There's a shocking example they give. The youngest type 2 patient found in Oklahoma was just 3 years old. 3. Now, compare that to 3-year-olds living traditional lifestyles, maybe in the Congolese or Brazilian rainforest. They just don't get type 2. What's the key difference, according to the book?
It boils down to that simple equation again. Too much energy in and not enough energy out. And they add pointedly, a big factor is simply living in the United States.
Yeah.
It really underscores how much our modern environment, our food culture, drives this epidemic. It's not primarily about faulty genes, it's about the lifestyle we've built.
Okay, let's touch on type 1 diabetes again for a moment. You said their cells are hungry and insulin sensitive because they don't produce enough insulin. But the book also warns that taking too much injected insulin can cause problems too, potentially leading to insulin resistance, almost like developing type 2 on top of type 1.
How does that work? It comes back to that same energy balance issue. Too much energy in, not enough energy out.
Yeah.
Even if you need insulin from injections, if the dose is consistently higher than what your body actually needs to process the energy you're consuming, those cells can still get overwhelmed. They can start to resist the insulin signal over time. A normal, healthy adult pancreas only secretes about 20-30 units of insulin total per day. So the book really emphasizes keeping injected doses as low as possible, working closely with your doctor, of course.
Yeah.
For type 1s, this helps prevent developing that secondary insulin resistance.
Right. Okay, let's pivot now. Let's talk about what the book sees as the root of the problem, the SAD or the standard American diet. The book really doesn't mince words here. It paints this picture of America the obese, America the critically, chronically ill. Pretty stark.
Yeah, it connects us directly to what they call our culture of abundance. We routinely eat things now that, historically, only kings or the super wealthy could access, maybe not even them. And this westernization of diet is why common chronic diseases, diabetes, heart disease, certain cancers, are much rarer in places where people still eat more traditional diets. They essentially conclude, we've created an enemy and it is edible. It's a blunt assessment, but hard to argue with when you look at the data.
The book uses McDonald's as a kind of shorthand, a symbol, not to pick on them specifically, but as representing this whole culture of excess, surplus, overload, overindulgence, the high-calorie, high-fat, high animal protein, high-sugar, super-processed foods that have become everyday staples for so many. It's a global symbol now, really.
And they tackle a really common belief head-on, the idea that it's all just genetics. The book states it very clearly. Genetics only loads the gun, lifestyle pulls the trigger. Strong words. Think of a powerful example, the Pima Indians in Arizona. They have one of the highest rates of type 2 diabetes in the world. But compare them to their genetically very similar relatives living a more traditional agricultural lifestyle in Mexico. Down there, diabetes is much, much rarer, almost non-existent in some communities. It powerfully illustrates how drastically diet and lifestyle can alter disease risk, even with similar genetic backgrounds.
And the book doesn't ignore the role of advertising in promoting the SED either. There's this anecdote from Dr. Dennis Deaton about his toddler who only knew maybe a dozen words. But driving past McDonald's, the child recognized the golden arches and shouted "Donald's" before even saying "Mama" or "Dada." That really puts it in perspective, doesn't it? How deeply ingrained these food associations become right from the start.
It's quite something. So all this leads logically to the dietary solution proposed by LCA, a plant-based diet, PBD. The authors are upfront about it. They say it's a major departure from the way you've been brought up to think about food, nutrition, even healthcare. It's a big shift for most people.
Okay, so if a plant-based diet is the answer, the book details these 6 protective health factors. Can you walk us through those? What makes this way of eating so beneficial?
Sure. First off, there's fiber. The book calls it the Rodney Dangerfield of nutrition. It gets no respect. But fiber is crucial. It doesn't raise blood glucose itself. It helps you feel full with fewer calories. And it actually binds to cholesterol and toxins in your gut, helping remove them. And here's the key. Fiber is found only in plant foods, meat, dairy, eggs. Zero fiber, Most Americans get maybe 10-15 grams a day. The PBD aims for 35-45 grams or more. Think whole orange versus orange juice. The juice spikes your sugar much faster because the fiber's gone.
That's a huge difference right there. What's next?
Second, the PBD is naturally lower in fat, especially saturated and trans fats. The standard American diet can easily be 40% fat, sometimes even 50% or more when people start the LCA program. The PBD has very little saturated fat and basically zero trans fat. Why does that matter? The book explains fat literally clogs cells, making it harder for glucose to get inside. This directly leads to higher blood sugar levels and forces the pancreas to pump out more insulin. It's like trying to pour syrup into a funnel that's already clogged with lard.
Okay, that makes sense. What about sugar?
Third, it's lower in sugar. LCA's stance is blunt. None is best.
Yeah.
They list all the hidden sugars you see on labels: fructose, high fructose corn syrup, HFCS, dextrose, etc. And they specifically call out HFCS for its link to central abdominal obesity, that dangerous belly fat.
Right. Now, protein is always a big question when people consider plant-based diets. How does the book address that?
Fourth point, adequate protein from plants. It tackles the old meat equals strength myth head on. It even references the China study, concluding that for many modern diseases, too much protein, not too little, is the source. The LCA diet is about 15% protein, all from plants, beans, lentils, nuts, seeds, tofu, whole grains. They debunk the incomplete protein myth, too. Just eat a variety of plant foods throughout the day, and you're fine. And importantly, plant protein is described as kidney protective. This is huge for diabetics, as high animal protein diets can actually accelerate kidney damage.
Okay, 2 more protective factors left.
Fifth, antioxidants and phytochemicals. These are the compounds that fight chronic disease by neutralizing harmful molecules called free radicals. Plant foods provide the lion's share of antioxidants like vitamin C, vitamin E, beta-carotene, and are the only source of phytochemicals. Phytochemicals are what give plants their colors, flavors, and aromas. Think flavonoids in berries, lycopene in tomatoes. These compounds protect the plants, and they protect us too when we eat them.
And the 6th factor.
Well, the 6th isn't a component of the diet itself, but a result of the other 5 combined with lifestyle changes. Improved overall health markers, things like lower blood pressure, better cholesterol, weight loss. They all stem from adopting this way of eating and living.
So we've covered the power of this plant-based approach, the fiber, the antioxidants, but the book is really clear. Diet is just one side of the coin. What's the other absolutely essential piece, according to the authors?
You got it. The book states it unequivocally. Exercise is medicine. It's just as vital as the food you eat. It's not just about weight loss, though that's often a benefit. It fundamentally resets your body's systems. The benefits are huge. Better blood glucose control, definitely. Your muscles use more glucose during and after exercise, so less insulin is needed. It improves insulin sensitivity, meaning your cells respond better to the insulin you do have. This is often why people can reduce or stop meds. But beyond blood sugar, exercise helps reduce stress. It lowers cortisol. It helps fight depression, boosts your immune system, strengthens bones, eases arthritis pain, improves sleep and memory, even offers protection against some cancers. It's a powerhouse.
Okay, but the book does offer a word of caution, right? A first things first point.
Yes, that's important. If your blood sugar is really out of whack, say below 70 or consistently above 250, they advise focusing on the diet first. Get the sugar more stable. Then gently introduce activity. Start with simple strolling or stretching. Listen to your body. They also list warning signs during exercise, like serious shortness of breath, dizziness, chest pain, and emphasize staying hydrated. Safety first, always.
Makes sense. Now, the book also spends some time busting common fitness myths, things that might actually stop people from getting started. What's one myth that really stood out to you?
Oh, definitely the no pain, no gain idea. The book flatly says this is false. Pushing yourself into pain doesn't automatically mean better results, especially for fat burning. Pain often signals you're burning glycogen, stored sugar, rapidly, not fat, and producing lactic acid. That just makes you sore and tired. The goal is sustainable, consistent effort in the right zone, not self-torture.
That's probably a relief for a lot of people listening. What about the myth that you can spot reduce fat, do endless crunches to lose belly fat?
Yeah, another one bites the dust. The book explains you can strengthen the muscles underneath the fat, like your abs. But you can't tell your body where to burn fat from. Overall, fat loss comes from consistent aerobic activity that creates a calorie deficit for your whole body. Sorry, no magic bullet for specific spots.
And for anyone thinking, I'm too old, it's too late now to get active.
Nope, that's a myth too, according to the book. It's never too late to start reaping the benefits of movement. So, what does the LCA activity plan actually involve? What are the pillars? It's built on 4 clear pillars: designed to be accessible. First is strolling, simple walking. They recommend just 15-20 minutes after each meal. There's a great story about a man named Jim whose sugar spiked after dinner until he started walking afterwards. Why? His muscles will demand some of the energy you've just consumed. Super simple, right? Their practical tip. Just park your car further away from the store entrance. Every little bit adds up. Pillar number 2 is stretching. They say it nurtures the body and eases the mind. The benefits are broad. Less muscle tension, less stress and anxiety, less fatigue, better body awareness, makes other activities easier, can even reduce minor aches like headaches. They recommend Bob Anderson's method, a relaxed, sustained stretch. No bouncing, no pain. Hold each stretch for 10-30 seconds, hitting all major muscle groups daily. Third pillar, strength training. Now, this isn't about becoming a bodybuilder. It's about functional fitness. Being strong enough to open a jar, lift your groceries, play with your grandkids without getting worn out. It improves stamina, energy, helps with glycemic control, and protects against metabolic syndrome. The key is proper form. Slow, controlled movements like 2 seconds up, 2 seconds down. Breathe correctly. Exhale on the effort. Rest 30-60 seconds between sets. They suggest doing this 2-3 times a week, about 30 minutes per session, with rest days in between for muscle recovery. And the fourth pillar is something called intermittent training, IT. They describe it as weightlifting your heart. Basically, it's non-continuous cardio with active recovery periods. You push your heart rate slightly above your target zone for a bit, then bring it slightly below to recover, then repeat. They say this is often more appealing and easier to stick with for people who are sedentary, overweight, or older compared to steady-state cardio. The idea is it keeps you in the aerobic fat-burning zone more effectively, prevents lactic acid buildup, which causes pain and fatigue, and ultimately leads to greater weight loss and greater body fat loss. Recommendation is 30-60 minutes, 3 or more times a week.
And I like that they encourage variety, too. Mixing things up keeps it interesting and might offer different benefits. Like hiking uphill burns fat differently than hiking downhill helps blood sugar. It's a toolkit, not a rigid prescription. Okay, this brings us to a really crucial dimension, the mental and emotional side. The book has this great phrase, "Your brain and emotions are your dinner companions." It tackles that fundamental question we all wrestle with sometimes. Why on earth do we make choices we know aren't good for us?
It's the million-dollar question, isn't it? The book introduces what it calls the motivational triad, 3 basic drives: seek pleasure, avoid pain, and conserve energy. It explains how things like sugar, but also caffeine, alcohol, nicotine, even harder drugs, they basically trick this ancient survival system. They give you a quick hit of pleasure, help you avoid discomfort, even if just boredom, and require very little effort. This leads straight to self-sabotage. The authors bluntly state, we must learn not to trust our instincts about what we want. We have to consciously override those primitive urges sometimes.
And it's not just about addiction in the classic sense. What about stress? How does chronic stress or burnout feed into diabetes?
Great point. The book highlights research showing chronic burnout, especially job-related, is linked to almost double the risk of developing type 2 diabetes. Why? Stress floods your body with cortisol. Cortisol is an insulin antagonist. It directly fights insulin's action, raising blood sugar. It also promotes storing fat around your abdomen, that visceral fat, which really worsens insulin resistance. So yeah, managing stress isn't just nice to have, it's critical for metabolic health. And then there's the link between depression and diabetes. It's a really clear two-way street. Wild swings in blood sugar can directly mess with your mood, causing irritability or depressive symptoms. And conversely, being depressed makes it harder to manage diabetes, less motivation for self-care, and actually worsens glycemic control and increases the risk of complications. Having depression beforehand even doubles your risk of developing type 2 later. It's all interconnected.
Wow. It really paints a picture of mind and body being inseparable. But the good news is these challenges aren't insurmountable. The book introduces a therapeutic approach called Rational Emotive Behavior Therapy, or REBT. The core idea, it's all in your head. Meaning, it's not the events that happen to us that cause distress, but our beliefs and self-talk about those events.
Exactly. REBT uses a simple model, the ABCs of emotions. A is the activating event. Something happens. B is your belief system, what you tell yourself about A. C is the emotional and behavioral consequences, how you feel and act as a result of B. The power lies in challenging and changing B, your beliefs, especially irrational beliefs and that harsh, toxic self-talk. You know, the inner critic saying, you fat pig, you'll never succeed.
Yeah.
Instead, RBT encourages practicing unconditional self-acceptance, USA. Judge the behavior. Okay, eating that cake wasn't helpful for my goals. Not your entire self. I'm a worthless failure.
Mhm.
It's about self-compassion, even while you're working to change.
And one really practical REBT technique is replacing demanding words like should, ought, and must with softer words like prefer or wish. How does that work? Can you give an example?
Sure. Let's take someone who's just been told they have prediabetes. An irrational, demanding belief might be, this must not happen. It's awful, terrible, I can't stand it. That kind of thinking leads to unhealthy, overwhelming emotions like panic or despair, which are paralyzing. A rational, preferential belief would be, I strongly prefer not to have prediabetes. It's really inconvenient and unfortunate, and I'm concerned, but I can stand it and I can take steps to deal with it. Half the difference. It acknowledges the negative reality, but frames it as a preference, not a catastrophe. This leads to more manageable, constructive negative emotions like concern or disappointment, which actually motivate you to take action rather than destructive emotions that shut you down.
That's a really useful reframing technique. And interestingly, the book links the plant-based diet back to mental well-being too, doesn't it?
It does. It points out that plant-based diets tend to be high in tryptophan. That's an essential amino acid your body uses to make serotonin. And serotonin is that key neurotransmitter in the brain, often linked to mood regulation and depression. So literally, the food you eat can provide the building blocks for a better mood.
It all connects. The book also touches briefly on the importance of sleep, right?
Yes, 79 hours a night, ideally in a very dark, cool room. This helps optimize melatonin production. Melatonin is crucial for sleep cycles, and it's actually built from serotonin. And getting enough sunlight exposure, especially in the morning, helps regulate that whole serotonin-melatonin pathway.
And just to round out the lifestyle factors, they mention smoking cessation.
Absolutely critical for diabetes control. Smoking makes insulin resistance worse. Quitting can actually help restore insulin sensitivity closer to normal. They acknowledge the fear of weight gain after quitting, but suggest that adopting the plant-based diet and activity plan at the same time can effectively manage that concern. It's a comprehensive picture.
Okay, so pulling all these threads together, diet, exercise, mindset, this leads us to the practical roadmap. The 30-day prescription for a personal diabetes miracle. It really boils down to making a conscious choice, committing to enjoy eating healthfully, and trusting that your tastes actually will change over time. So, expert, what are some of the key concrete recommendations for someone embarking on this 30-day program?
Okay, let's break it down. For nutrition, it's a strict 100% plant-based diet for the 30 days. No meat, no chicken, no fish, no eggs, no dairy. Focus entirely on whole, unprocessed foods, fruits, vegetables, whole grains, legumes, beans, peas, lentils, nuts, and seeds. Look for foods with the shortest ingredient list. They suggest trying one new fruit, vegetable, or whole grain each week to keep things interesting and broaden your nutrient intake. And a key strategy for managing energy levels is how you structure your meals. Eat breakfast like a king, maybe 3 to 5 carbohydrate choices from healthy sources. Lunch like a prince, similar, 3 to 5 carb choices. But dinner like a pauper, either skip it or keep it very light, maybe max 3 carb choices. The logic is to avoid that too much energy in, not enough energy out scenario right before you go to bed and become inactive. Hydration is simple but crucial, 8 to 10 glasses of plain water daily. Your urine should be clear or pale yellow. A practical tip, stop drinking about half an hour before meals and wait an hour after eating to resume, as drinking with meals can dilute digestive juices. The activity plan is quite structured for the 30 days. Start the day with 30 minutes of gentle stretching. Take a 15-20 minute stroll after each meal, breakfast, lunch, dinner. Aim for 60 minutes of intermittent training, IT, 5 to 6 times per week, gradually increasing the intensity as you get fitter. And fit in 30 minutes of strength training 3 times per week on non-consecutive days. It's a significant commitment, but designed for maximum impact. For rest, prioritize 7 to 9 hours of quality sleep each night. Try to establish a regular sleep schedule, early to bed, early to rise. And make sure your bedroom is totally dark and cool. Don't forget sunlight. Get a 30 minutes of outdoor light exposure within 30 minutes of waking up. This helps set your body clock. Also, aim for 20-25 minutes of midday sun exposure between 10 a.m. and 3 p.m. when UVB rays are strongest, 3 to 4 times a week for vitamin D synthesis. Vitamin D is incredibly important for insulin production and how well your cells respond to it. Studies show significant improvement, like 60%, in insulin sensitivity for those who were deficient and started supplementing or getting enough sun. The book stresses aiming for optimal vitamin D levels, which are likely higher than the minimum needed just to prevent rickets. And finally, the medical aspect. Monitor your blood sugar frequently, especially during these 30 days as things change rapidly. That means checking daily upon waking, before and after each meal, and at bedtime. If you're on insulin, checking around 1 a.m. is also recommended initially. Staying close touch with your doctor, maybe even visiting twice a week at the start, especially if you're on medications that might need adjusting downwards quickly. And the goal isn't just to get into the normal range for things like cholesterol or blood pressure, because normal in the US often means you're still at risk. The goal is optimal health parameters, truly healthy levels.
You know, the book makes this interesting comparison. We hear about the idea of a polypill, one pill that combines meds for blood pressure, cholesterol, maybe blood sugar. But they propose a lifestyle polypill, which is what it's our diet loaded with fiber, antioxidants, phytochemicals, low glycemic index complex carbohydrates, beneficial fatty acids, minerals, vitamins, and other micronutrients, plus a regimen of proper physical activity and a cognitive behavior approach. And the punchline, it costs nothing and has no adverse side effects. That really makes you think, doesn't it?
It really does. And what's so compelling is that these exact same lifestyle changes that target diabetes have massive benefits for preventing or improving other major chronic diseases too, like cancer. Plant-based diets and regular activity are consistently linked to lower incidence of many common cancers, stroke and hypertension. Just increasing fruit and vegetable intake significantly reduces risk. The whole PBD approach, plus weight loss and activity, works wonders for lowering blood pressure, often better than meds. High cholesterol. You can achieve truly optimal cholesterol levels, like total cholesterol under 150, LDL under 70, with diet and exercise, offering near total protection from heart attacks, according to some studies. LCA patients often see their cholesterol drop 15% in just the first 2 weeks on the program. It's fast.
Wow. And lastly, they draw a connection to Alzheimer's disease.
Yes. People with type 2 diabetes have a much higher risk, 2 to 3 times greater, of developing Alzheimer's. The book even suggests that Alzheimer's might fundamentally be another disease of energy imbalance, caused by too much energy in and not enough energy out, affecting the brain over decades. It really ties everything back to that core principle.
So as we wrap up this deep dive into the 30-day diabetes miracle, the central message feels incredibly clear and honestly quite hopeful. Your lifestyle choices have this profound, direct impact, and the devastating consequences of diabetes, the book argues, are not inevitable or irreversible. There's real potential for change.
Absolutely. And the book leaves you with this powerful, almost confronting set of questions to ponder. Are you still skeptical? Ask yourself what good reasons you have not to try our program for 30 days. Are you afraid it will be too hard? How hard will it be to deal with blindness, amputations, and an early death? Or are you afraid of failure? Many of us freeze in the face of this fear before ever trying to change. Yet isn't what you've been doing to treat your diabetes failing thus far? Are you simply a doubter of miracles? Ask yourself, if you lower your blood sugar, insulin resistance, weight, cholesterol, blood pressure, and risk of heart attacks, strokes, Alzheimer's disease, and cancer all with good food and less medicine or none at all, couldn't you call that a miracle? Could you even call it a cure? You decide.
That's quite the challenge to leave us with, isn't it? It really encourages reflection on our own habits, our own health. Maybe think about what small, actionable step you could take, even starting today, on your own journey toward optimal health. What's the one thing that really stands out to you from everything we've discussed?